Okay, I'm with Lyndsey Godwin of Planned Parenthood in Nashville. And Lyndsey, thanks for being with us today.
No problem, thank you.
And I just wanted to ask you a little bit about Planned Parenthood. If you could tell us how it got started and maybe a little bit about the types of services that you offer.
Certainly. Here in Tennessee, and we started about in the mid-'60s.
All right.
And we actually had a location here in Nashville and several locations in Knoxville, but they were separate affiliates, so they're sort of separate organizations.
Okay.
There's also an organization in Memphis. And they served to basically give birth control information and sexual health information and reproductive health information.
Okay.
So in East Tennessee, they'd literally drive, the nurse practitioners and the doctors would literally drive into the hollers and go into rural communities and give women information about how they could space babies, how they could access birth control, so that they could feel empowered to do that.
Exactly.
Here in Nashville, we did some of the same stuff. Clearly, it was much less rural. And one of the early programs was driving to Hendersonville to visit mothers who had just given birth, to tell them, give them information about how they could space babies and that sort of stuff, so that women were able to have a little bit more control over that and not feel like they were sort of stuck in a cycle.
Exactly.
So that's sort of how things started.
Okay.
In 2000, those organizations all combined to become Planned Parenthood of Middle and East Tennessee. And a lot of people ask, were they providing abortion services or that sort of thing. Nashville started providing abortion services in 1973, which is just after it became legal.
Sure.
And East Tennessee was not providing abortion services until actually in the last 10 years.
All right.
So that's sort of a little bit about how we got started.
Okay.
Our services cover a broad range of anything that has to do with sexual health. So that includes at our health center sexually transmitted infection testing and treatment for some of those infections. It also includes pregnancy tests and annual exams for men and women. So those, for a woman, include a pap smear and the breast exam. For men, it could include screenings for testicular cancer or prostate cancer.
I didn't realize that.
So we do, and we provide services for men and women across the board.
Okay.
We also do some general health stuff. So if somebody's got a cold and they can't get into the health department or to their primary care physician, we can, help them with that sort of stuff.
Okay.
Oftentimes that stuff comes alongside somebody who's already coming in for something else, and you're like, oh, I've got a sore throat. Can you check that out? We also do what we call options counseling. So if a woman is pregnant, she has 3 options in the United States. She can choose to parent, she can choose to write an adoption plan, and she can choose to have an abortion. Okay. So we will sort of lay out those 3 options for her so that she can make the best decision for herself. Okay. And then if she chooses to parent or she chooses to write an adoption plan, we'll actually put her in contact through referrals with the people she would need to be in contact with. So if we're talking about parenting and going through the birth process, we'll get her in contact with TennCare or Medicare or Medicaid or whatever it is that she might need so that she can get the proper prenatal care. All right. If she decides to go through the adoption process, we'll get her in contact with adoption agencies where she lives. And if she does choose to have an abortion, we provide those services at our health center. Okay. We also give out free condoms, and we do education, and we do all sorts of things like that at our health center. All right. The other 2 sort of legs of what we do are the advocacy leg, and those are folks who talk to representatives and senators, both at the state level and at the federal level, to protect our access to sexual health information and services. Okay. And then we have the education department, so it's folks like me and a few other educators who go to schools and go to churches and go to all sorts of places to do just general education. Okay. It can range from anatomy to healthy relationships to sexually transmitted infections to anything in between.
Now, how would a person find out about your services, or how might they be referred to your organization?
There are several different ways. Excuse me, pardon me. If somebody was just sort of wanting to find out more information, they could go to the website, which is ppmet.org. All right. www. A lot of times people get referred through other social agencies or other organizations in the community. Also sometimes through the schools. We have several teachers and counselors and administrators who will, if a student has a question or is pregnant and doesn't know what to do and that sort of thing, they'll send them to us so that we can help them through that process.
All right.
We also have a pretty long-standing relationship with the health departments. So we do a lot of partnered work through the health departments.
Okay. So you partner with the health department. I heard you say TennCare, also some adoption agencies. So a lot of different agencies.
A lot of different agencies. Yeah, and in addition to those, anybody who does any pregnancy or STI prevention sort of thing, we're on coalitions. We do work with other organizations that do that stuff. We also are partnered with like the Sexual Assault Center, folks who are working to prevent sexual violence. We do stuff with HIV/AIDS service organizations, so places like Columbia Cares or Nashville Cares. And we also actually are starting to do more with churches and faith communities that are trying to sort of open up the doors to the conversation about sexuality. And especially in communities where HIV and AIDS or syphilis or unplanned pregnancies are becoming a bigger concern.
Okay, fantastic. Okay. Now, just in terms of privacy, because I know privacy must be a big issue for some of the folks who come through here, even if you had, let's say, a minor who came through here. Maybe you could share with us some of the confidentiality rules and privacy and all that kind of stuff.
Definitely. In general, all of our services are confidential. And that applies for whether somebody is a minor or an adult. We do, however, follow all reporting rules. So if there is an issue of abuse or other sorts of violence, those are things we have to report. So say a minor comes in and says something about parental abuse or sexual abuse in some sense, then that's something we have to report. So that's when the line of confidentiality gets crossed. But other than that, like if a teenager comes in, say a 15-year-old comes in and wants to get sexually transmitted infection testing, they can get that without us giving any information to their parents. We will frequently encourage teens to talk to their parents themselves, and we may give them tools. Sometimes teens will ask if we'll help them, make a phone call or talk to their parents or, tell them how they can do that. But we generally don't cross that line unless there's a reporting law that requires that. One of the exceptions to that is in terms of abortion. In the state of Tennessee, someone who's 17 or younger has to have parental consent to have an abortion. Either that or have a judicial bypass. And so consent not only means a parent signing a form, but a parent coming with them and being in the process with them. So we won't provide any abortion procedures to a minor without that.
Is there a waiting period as well in Tennessee? I wasn't sure if there was or not.
There's not currently a waiting period in Tennessee. There have been some attempts at legislation for that, but currently there's no waiting period. That's a good question. A couple of places where that confidentiality question gets a little tricky. One example is if a minor patient comes in and is pregnant, sometimes a parent might want to have an abortion, want the child to have an abortion, and the child may not. And we will always stand on the side of the patient. So in that case, we would support the minor's choice and decision to have the child or to put it up for adoption. And do whatever we could to support that. It's very important for us that the patient gets to make the decisions and the best informed decisions for their lives. We don't take the step of judging and deciding what's best.
I bet there can be a lot of anger and arguments and that kind of stuff over those.
It can certainly be tricky. Another place where it can sometimes be difficult, or just tricky at least, is around the issue of statutory rape. In Tennessee specifically, there are no reporting laws that require you to tell a parent or tell the police if a minor comes in and says they're involved with in a relationship with someone who is an adult or 4 years older than they are. What the Tennessee law does say is that it recommends sort of supporting that teen and telling them to, get some access to tell a trusted adult to do those sorts of things. So that's what we would do in that case. Sometimes, somebody will ask, what if a 14-year-old came in and said they had a 25-year-old boyfriend? we would talk to them about issues of power and how that might not be safe, and help them sort of think that through.
Sure.
We also would offer to give their parents some information about what they could do in that situation.
Okay.
So, but again, that's on the patient. If the patient says it's okay for us to give that information to their parents, then we will.
Okay.
If not, then we can't cross that line.
Now, do you have more adults that you serve or teens, would you say?
That line between teen and adult gets really tricky.
Yeah.
The majority of them are 18 or older.
Okay.
We do serve a lot of teens, though, because it allows them to have access to health care without their parents. Because some doctor's offices, some pediatricians would tell their parents what's going on.
Oh,
so some teens choose to come here because they come to Planned Parenthood because they have confidential options. There are also a lot of adults who choose to come to Planned Parenthood for sexual health stuff, because they don't necessarily feel comfortable with their primary care physicians, and they don't have a good relationship, or they don't want to do a sexually transmitted infection test with the same person who talks to them about their strep throat or their cholesterol.
Okay.
So
it's nice that they have that option.
Yeah.
Now, I heard you mention that there are some services for men. About what percentage of men seek out your services? Just a ballpark estimate, would you say?
That's a really good question. I don't have a good percentage, and I know it's a small percentage.
Okay.
I think it's, and again, this is an estimate, it's around like 5 to 8%.
Okay.
Most of our clients are female.
All right.
We're continually trying to work on figuring out how we can let more men know about our services.
Okay.
And I think most men come when they want testing.
Sure.
Because again, it's confidential, it's low cost. All of our services are offered on a sliding scale.
All right.
So if somebody makes a whole lot of money, they're going to pay full price. If somebody makes very little money, they're going to pay a much lower cost.
Okay.
And the majority of our patients fall somewhere on that sliding scale where they pay a reduced cost.
Now, I heard you say that you get some of your referrals from schools, school counselors. Are there any school health clinics in Nashville where you play a role?
There aren't currently.
Okay.
There are some United Neighborhood Health Services clinics that are tied to schools that we sometimes partner with.
All right.
There's a group in Nashville y'all probably know called the Oasis Center.
Yeah.
And they are frequently involved in school stuff. They do counseling programs. They do sort of teen enrichment programs. And so we do a lot of partnering and work. But we don't have any clinics in the schools currently. So
now, if you look at some of your challenges as an organization, what would you say some of those challenges are?
Well, clearly being an organization that deals with sexuality and that provides abortions, those are going to bring up major conflicts for some people and some controversies. There are people whose full-time job it is to try and restrict access to abortions or to try and restrict access to information about sexuality. Okay. And so we run into some conflicts there with that. More generally, we also hit conflicts and controversies a little bit when we try to talk about a sort of overarching healthy sexuality. And what we mean by that is letting all people have the information so that they can make the best choices for their own sexual health. So factual information, full information, that sometimes means talking about anatomy, talking about sexually transmitted infections, things that people are uncomfortable about. And part of the fear that oftentimes comes around that is that people think that if you tell people all the information, it's going to make them more likely to have sex. Right.
Sort of like the idea if you talk to somebody about suicide that you're going to send them over the brink and they're going to go commit suicide.
It's very similar to that. But the studies show that, in fact, by giving people all of the information, that includes for us talking about abstinence, talking about decision making, talking about risks, and talking about ways to protect yourself. If you give people all that information, especially with teens, they are more likely to make smarter choices. That includes waiting to have sex.
Okay.
There are studies that show that. There are also studies that show that if teens hear both messages, I want you to wait and I want you to be safe, they don't hear those as mixed messages. A lot of parents, a lot of adults, a lot of people who care about kids think if they hear those mixed messages, they're going to think it's okay and they can just go out and have sex. When the studies show that when kids hear those messages, they think, all right, that makes sense. I can delay sexual activity. So,
now, are you aware of any recent studies on teenage pregnancies, whether they're going up, going down? Where are we at with that?
They've recently, Guttmacher is a great place to look. I can't even spell it. It's German. It's Guttmacher. They do a lot of research around sexuality.
All right.
But if you go online and look it up, you'd be able to find a lot of the research and studies that I'm talking about. But in the last, at least studied about 5 to 10 years, pregnancy rates and STI rates amongst teens have started to rise again. In the early 2000s, they had sort of declined and were continuing to decline from the mid 1990s. They had been declining, but currently those rates are going back up, including things like syphilis and gonorrhea. And the unplanned pregnancies for teens. There's some research that indicates that maybe because there was such a focus on abstinence-only education that teens were making choices that they didn't know necessarily all the risks for. So they were having sex, or they thought they were having sex that was protected, or they got into a situation where they hadn't decided that they weren't going to have sex or that they were going to protect themselves, and crossed a line that then put them at risk for an STI or an unplanned pregnancy. So yeah, that's sort of where things are right now. In Tennessee specifically, or especially in Memphis, in Chattanooga, and Knoxville, the rates of syphilis and gonorrhea are much higher, are even high levels in comparison to national standards. Pregnancy, especially for Knoxville and Memphis as well. So,
if you could give us just a little bit of an idea about your staff here, the types of professionals that you have, medical or whatnot, just the types of people who work here.
Yeah, it's actually a really interesting range. We have, at our health center specifically, we've got nurse practitioners, and so those are folks who have their nursing degrees and can write prescriptions that are then backed up by our doctors. So we have doctors who perform abortion procedures and who read through all the prescriptions and make sure all those are legitimate and sort of sign off on those. We also have medical assistants, and our medical assistants have a range of education. Some folks are straight out of high school and have had experience and sort of learned the ropes of medical tracking and all that sort of stuff through our health center or through other health centers, and then come to us. Some of them have two-year degrees, 4-year degrees. We have a couple of folks who have master's degrees either in administration or in social work or in some sort of medical health sort of field. So it's a pretty wide range in that sense. If we're talking about education and the administration office, most of the folks here have bachelor's degrees, somewhere focused in health or human services. If we're talking about specifically the folks who are doing that sort of backbone administrative work, they've got those administrative degrees and those, how to take care of the books and all that sort of stuff, accounting.
What would you recommend if a student wanted to go into this field, wanted to work with Planned Parenthood? What kind of experiences, education, anything would you recommend?
There'd be a few things. I would recommend some focus on health and specifically around sexuality. There's a lot to learn and there's a lot we don't know in just a general sense. So you go walk up to your average classmate and there's going to be a lot of things that they just don't know about their bodies and how they work and that sort of information. So just sort of boning up on some of those things and maybe taking time and opportunities to volunteer, whether it's with Planned Parenthood or with other organizations that do health issues specifically around sexuality or specifically around gender or relationships. All those things are intertwined. So it would be one thing that I would suggest. Another thing that I would consider is if you have an opportunity to take classes that would either in college that would talk about do like women's studies or women's history, that sort of thing, just because it'd give you a basic understanding of what birth control has looked like in the United States, what women's issues have looked like in the United States, what talking about sexuality has looked like in the United States.
Just to kind of give you that context,
right?
I guess,
right.
Yeah.
Those things can be helpful just to give you the context, like you said, but to also give you sort of an idea of what's really interesting to you.
Sure.
But what's interesting, at least in my experience, is that those classes can take scientific views. Some of them can take historical views. Some of them might be focused on literature. So there are lots of different options in terms of that.
Okay.
I would definitely at least start there. And then other than that, reading the headlines, finding out what's going on in in the state, finding out what the bills are, and being even more clear about what your viewpoint is and what's important to you, so that you can clearly express that. So.
Yeah, I guess you really have to take a look at your own values, your attitudes, your beliefs. I guess that will figure into it heavily too.
Definitely, definitely. And we think it's very important for a person to know specifically what they believe and what they care about, and to hold strong to that, and to make decisions based on the best information available and their own morals and ethics and values.
Sure.
So, get out there and find out what's going on.
Okay. Well, Lyndsey, thank you so much for spending time with us.
No problem.
It was very informative, and look forward to talking to you in the future.
All right. Thank you.
Okay, thank you.